The most common way that's going to happen is it's going to come through your mouth or it's going to come through your nose. We're constantly moving air through our mouth and our nose. We're constantly sucking air in, we're blowing it out. The most likely way that you're going to get sick from COVID-19 is you breathe it in either from your mouth or your nose. Now, Dr. Fauci's onto something in the sense that we have mucous membranes in our eyes. Now, there's maybe not as much air movement. The risk would definitely be lower, but if you wanted to have 100% protection, there would be benefit in covering your eyes. Now, in healthcare, we do this. Healthcare workers who are taking care of COVID-positive patients, who are going to be in very close proximity to those patients, we're not talking 6 feet, we're talking in inches, we do require them to wear a face shield for 2 reasons. One is for the reason that Dr. Fauci mentions. We want our healthcare providers to have their eyes covered because we really feel like we can't take any chance whatsoever in exposing our workers to that risk. The second reason we do it, we use the face shield instead of the goggles, is we want to preserve their mask. They're all going to be masked. A face shield that covers the mask prevents any gross contamination from landing on the mask and then rendering that mask unusable, where we would have to use more PPE. So from a health standpoint, it's been known that COVID-19 can be contracted through mucous membranes. We know that the mouth and the nose are by far and away the most likely reason or the most likely way that you're going to contract COVID-19, but it's not implausible to think that if you were in very close contact with people and you could get droplet into your eyes, that you could get infected that way. I think, when I think about this and, the general population, for those people who are maybe at very high risk of a bad outcome from COVID-19, those who are elderly, those who've got comorbidities, who really want to take every effort possible to reduce the chance that they could get COVID-19, when they're out in public, it wouldn't be unreasonable to cover your eyes. Now, whether you use safety glasses, sunglasses, formal goggles, I think, anything would be better than nothing in that situation. But I feel like we are having a difficult enough time convincing people to wear face masks. At this time, I would trade a face mask for goggles as far as, wear that face mask as a start. And that would really help our communities out as far as reducing transmission of COVID-19. If you're extra worried, you can wear the goggles. If you're not going to be super close to people, I don't think there's a universal recommendation at this point to wear the goggles, just because the transmission rate is so much less compared to nose and mouth. So that would be our advice at this point in time.
I'm just thinking, workers that might be, in the drive-through, right? Sometimes people aren't wearing their masks necessarily and everything. You think people that are, maybe reaching over to give somebody their ice cream cone in the middle of summer, you think maybe they should be wearing those, just, because they're kind of on the front lines.
Yeah. I think that's a good point. So if you have, if you're an individual and you feel like it's very difficult for you to be in a safe environment, if you're in an environment where maybe mask mandates aren't enforced or aren't present, and you find yourself in close contact with individuals who are not wearing a mask, they may not be socially distancing. We know that those things increase your risk of contracting COVID-19. Those frontline workers who don't really have a choice, they may want to elect to wear some sort of eye covering, eye goggles, glasses, to just further reduce the risk that they could get sick at work.
That makes so much sense. We talked briefly just about anything, would work in this situation. Speedos, would they be maybe the gold standard because they suction there? Or is that medical grade style? What would you recommend if you really want to go all out here?
Yeah, so when we think about droplets getting into the eye, something that seals the eye socket, such as swimming goggles or other goggles that have pads, those would be the most effective. For the most part, a lot of these droplets are large. They tend to come at you straight on. So even regular sunglasses or safety glasses would be relatively effective, although maybe slightly less effective than some sort of goggle that actually had a seal of some sorts.
Absolutely. I would just like myself today, I unfortunately have to get on a plane to Nashville, which I'm not looking forward to, but I will be definitely, PPEing up as best as I possibly can. I would imagine your advice.
If you wear Speedos, send that picture to me.
I'll probably be wearing this Badger Shield plus those sunglasses right there. That's I know. If I need to go find some Speedos, but yes, I would imagine that's probably, if you do have to do any traveling in close contact, maybe this summer or any time when COVID season, might not be a bad bad idea to pull out all the PPE.
Yeah, I mean, eye coverings or eye protection certainly adds some incremental benefit over the other things that we've talked about, masking and the hygiene, the social distancing. So, if you're thinking to yourself, I want to make sure that I do everything possible to reduce my risk of getting COVID-19 because I need to do some sort of activity that I know increases my risk, adding something like glasses or goggles would be one way that you could do that.
Absolutely. Trying to think, guys, anything you think I've forgotten to ask that you think I should be sharing
I feel like
about
that
this?
first volley there, I went on for like 5 or 6 minutes.
I know, which is what we want.
that.
I know, right? Exactly. No, I think we probably got plenty on the topic. Let me